And we will now continue with the last session that we called Moving Forward. And our speakers will be reflecting on the messages we have heard today. There was a lot of interesting conversation. We have heard about patient safety, quality of care, improvement of the systems from all different angles. And we will now try to summarize today with our closing session. So let me introduce you our speakers. I need to find my... So first of the speakers, well, one of the speakers is Penilla, that you have heard already, the president of the European Patient Safety Foundation. Then we have Kristian Michnacs from Edwards Lifesciences, who will be covering the industry view. So Penilla is there from our patient safety view and the patient view. And then we have José Mira, who is our fresh winning Butterfly Impact Award project. And we are still waiting for Adriano Friganovic, who is running the workshop with nurses. So I think they are kept in discussion and will hopefully join us very soon. So let me start with the first question to Kristian, because he will need to leave us rather early. So what from you have heard from today's discussion and the well-being of healthcare workers, what would you say are the most pressing priorities for improving patient safety?
Yeah, thank you, Mirka, for this question, which most of it all brings people to a deep dive when answering it. Yeah, so before I start to deep dive it, I want to thank you, Stefan, and of course Penilla, for this great organization of this Congress here. I think this conference raises a topic that is most of it all completely under the radar, as we heard from José Luis, for example, today. And that's why it is so important that this Congress is ongoing and that we have the possibility to discuss here with this group. So to your question. So first of all, I was pretty impressed because of the presentation and the keynote that was given from William with the first experiences, or not the first, the experiences basically coming from hospital workers when they use AI or, let's say, data technology in day-to-day patient care. I think what we have to separate in general is that when we're talking about those kind of technologies and the implementation of it, that we basically have two categories. One category is a technology much more for administration, and the other category is for patient care. And these are completely different things. That doesn't mean that one did not impact the other. This is the case. However, the experience that has been shared as a majority today, and not only from William, is frustration about the usability of administration IT. And of course, at some point, artificial intelligences or dynamic or status algorithms are included. And for just with focus on that area, I think that the usability and the intuitiveness of those kind of technology solutions is a huge problem. So you can say that those kind of technologies are not intuitive enough, that people can work smoothly with those kind of solutions and having a better day-to-day life. What we do in Edwards Life Science is a different area. So when we talking about IT solutions or AI solutions, then we talk for 100% about technology that is used for patient care. And our focus is definitely to find the right solution for the right problem, which is a very limited perspective on these technology areas. So we, in Edwards Life Science, we have no interest in giving the solution that one fits all. That's not in our interest. So, and I think that we are decades away from something like a healthcare WeChat solution that can solve everything. That is not existing, and that will not existing for the next couple of decades. That's what I think. So when having a focused solution that tries to solve an existing problem that you can determine, that you can measure, where you have objectives for, that is maybe a good solution, and that's our strategy to drive technologies in this regard. Let's say a major lack that I see is that technologies are implemented in patient paths. However, the patient path did not change. Mm-hmm. Everything remains the same. And to have the expectation that this end in a good result is maybe not the right one. So when implementing a different tool in an environment, it is completely clear that the environment needs to be changed as well. In which angle or in which level is a different thing. But this is really important to understand, that the implementation of a technology, independently what kind of technology it is, the environment and the people that use it needs to change as well. That's really important. And that is maybe also something that has been described when we're talking about technology fatigue or frustration about the usage of it and such. So these basically are the major topics that comes to me when I think about this day so far.
And so just continue with this flow of reflection. So what is the support that we need to make this work and make this happen?
I think when it's about the implementation as itself, it is really about education. So we in Edwards, for example, we have a lot of effort on the professional education side. We have a technology, good. We know that it works, better. However, it can only work properly when the people that use the technology have an education, appropriate education, not only for introducing the technology in a hospital or in a team, also for follow-up on it. So let's say profiling the education based on the experience level that the people have with it. That is really important, because then you can guide the people, you can support the people that use a technology as long as they need it. Up to a point where you can say, now you can do it by yourself. Fine. And this education process is a major part of the implementation, and we are convinced that without those kind of activities, also a good technology cannot bring the full value where, let's say, where it's basically intended for.
Thank you very much. Penilla, you are present at European levels of mainly related to the cancer care and among other activities. From your point of view, where do you see the place for better collaboration on a European level? Where is the place where we can bring and we can maybe repeat what we were trying to do today, and to have all stakeholders bringing their voice for improving of patient safety?
Well, I think, first of all, we have an aging population. We will face a massive amount of people who have comorbidities, and that really requires another structure, I think, or organization of healthcare, and also other efforts in the life science industry maybe, and the collaboration also between patient organizations and so on, because people will suffer from all kind of different diseases or diagnoses. So we really need to collaborate for patients in that respect. But already now we can see You mentioned cancer. I have a position for the European Commission for implementing the Europe's Beating Cancer Plan and the Cancer Mission with the Horizon program to fund also all these efforts within cancer. And I think we can actually use that as a good example for people to see the value of collaboration between colleagues all over Europe, or even also outside Europe, within life science, within patient organizations or patient advocates, and of course healthcare. We can see a very good example from, we heard it also here mentioned about cancer comprehensive centers. This would not have been happening at all, I believe, 10 years ago or something like that, because we now require collaboration in different projects for the European Union. And I do believe that is good. We need to collaborate. And if we don't have figured that out ourselves already before, money will help, of course. When you have funding for projects all across Europe, you can also make it possible to have results, outcomes for the patients, which I am also very, very engaged in, working also with my Swedish initiative, FOKUS Patient. So I do believe we need to see all our interests and angles of collaboration together, because I learned also something from my previous background as an MP in Sweden, that when we also approach policymakers together, independent of where we come from, but we have a common goal to work for, a common mission, or so to say, then we will also be heard or listened to by policymakers. But if we come one and say that we are all unique, we all need this and that, it won't work. So if we will really reach out to policymakers or different stakeholders in society, we need to go together. So that's also why this conference, I believe, and the European Patient Safety Foundation is so important. It's because we need to see that our work in progress will get results at all levels, meeting each other and creating networks.
Thank you, Penilla. So just to again follow up on what you were saying, José, you worked a lot on the second victim syndrome and on this project that we have heard. And these are all requirements that we should do. What are the practical steps? What do we really need to do? Where to start?
Yes. Well, we started with this project because I think that we are very happy because when we are talking with professionals and we use the term second victims, maybe many professionals in the room are not familiar with the terms. But 2 minutes later, when we describe what second victim is, a majority of them, practically all, understand perfectly what is the topic in which we are talking, and understand that working in this area is essential to ensure patient safety. So in this sense, I think this is clear. But there are some different barriers. There are barriers, for example, the differences in the legal scheme in our countries. No-fault system in the north of Spain, for example, Denmark, or in other countries, in a few of European countries, represents a different setting in which we can understand the occurrence of the adverse event and, for example, the open disclosure with the patients and relatives in a very different manner than in the countries like Spain, for example, with a tort system. So legal barriers, I think, are very, very relevant in this case. The second is that we need to understand that it's possible to make mistakes. This is clear for all because we are human, but when I am a patient and in the surgery room, I want that there is no space for any mistake. So really, it's a complex situation because any can understand that human make errors, but many citizens are not able to understand that physicians, nurses, in a general healthcare professional make errors. So this is an imbalance. From my point of view, we advance a lot in patient safety in our institutions. If we see some years ago in any of our, if you remember what happened in the 80s or in the 90s, it's completely different than today. But all our actions are inside the walls of our healthcare institutions. Usually there is not any very good experience going outside of our walls. And citizens probably have a different view about the problem. So I think it's the time because safety practices are common in any of our institutions. It's true that in some cases and countries, formal approaches in patient safety are more prevalent and more frequent than really practical things in patient safety. This is true. But I think that one of the problems to a better understanding and to support second victims is not only to develop intervention to support professionals, is also to explain to the society what really is occurring in our setting. Because maybe people have an idealistic view about what the care is. And in the same time, I think that we need to, for example, this day, I'm very happy to stay here because it's a lot of ideas about the things. I have a list of many of them. But for example, well, it's clear that the patient are in our hands during a period of time. But what happened at home? So the co-production to obtain good outcomes is also a shared responsibility between relatives, patients, and professionals. So I think, and it's related with your question, because there are also second victims among the relatives caring people, because professionals are human and make mistakes, but relatives of patients make mistakes carrying their parents, children, or whatever, because they are also humans. It's a human condition. So this is the situation.
Thank you very much, José. And now a question for Adriano. You are very active also on representing nurses on the European level and also, I think, international level, so on many different levels. You are trying to make this voice of nurses heard and to bring a change. So and we know that there is a crisis now with nurses. There is a huge shortage. So what are your messages also in link with the new technologies and what we have heard today, and together with the messages that you try to bring? Where is the way for moving forward? What should we be doing?
First of all, I want to apologize because I was late. Our workshop was so dynamic we couldn't stop.
That's what we saw.
But I think the starting position that we have to realize, at the moment I'm representing nurses, another moment I can be a patient. There's no sides. We are all on the same side. The other thing we realized in ESNO that we are all working in our own silos and not connecting. This conference is really good because interconnecting different professions, and we can see different kind of views: nurses, doctors, informatics, patients. Well, everyone is here, and that's really important to create new directive and new ways of working for this foundation. On the other hand, regarding the technologies, well, there is a lot of new things, but it's a normal human reaction is resistance. And a lot of nurses, I would say about nurses, resist to some changes in their process, in their work settings. And we have to slow process of implementation of changes and work a lot with the education and start with the kids in the schools, in the universities, because there's where we can change the attitudes. It's quite heavy to change someone who had, I don't know, 60 years. Well, maybe it's possible, but it's easier to start from the beginning. And I think that's really important thing what we have to do. And the last thing, I think we have to work a lot with the politician, because patient safety should have to be on the agenda on the European Commissioner, future European Commissioner, we still don't have one, for ministers of health, because we are doing a lot. But if we want to be a mandatory, it has to be in national frameworks. And some countries doing better, some countries doing less, but we are in European Union, we have to be harmonized in the patient safety and offer the same possibilities for our patients, because it's not about us. We are professionals, but we have to talk what we can do for the patients, and that's my primary message.
Thank you very much. And today, the whole day, we were having a panel discussions, and we were having a forum here. And now I would like to ask you, as a part of this conference, what if someone would like to share your personal commitment, what you have heard today, you are taking home, and what do you plan to maybe change or to think differently? How today maybe influence your thinking? Is there anyone who would like to share something?
Or maybe also people could, bring us some messages to...
Yes.
I mean, we are working at the European level, and we have a lot to do, so...
Well, we can prepare the joint statement after this Congress and sign it and try to force the politicians, because at the end it's about politics. On Tuesday we had a policy breakfast meeting with two European members of the European Parliament, and they committed that they will help specialist nurses to harmonize education and to get recognitions. But they promised in 5 years, because it's their term, and we will keep it. One is from Spain, Elena Navado, I think.
So let me change the question then, okay? And I will just adapt it a little bit. What should be in the joint statement then? But
Let me...
I think the joint statement suggestion is excellent.
Yes, because there are people...
No, sorry, yeah, the
us.
joint statement is excellent, because that will actually mean there is something concrete coming out of this. Sorry, not to ill intended. It's just because when you get a consensus statement from people with actual influence, you then again affect funding, decisions, etc., because you take it to another level. So I definitely support that digital solutions is the way we actually maybe can overcome some of the challenges we have in healthcare in the future. And then, of course, there's lots of things that needs to be done. But just to note that it's actually something that this organization finds important would be extremely valuable, I think.
And what would you like to see in the joint statement?
I would like to see that actually there are solutions already that can help patients. And there is no need to wait, because every time we wait, actually patients die unnecessarily.
I think, we heard Eleonora talking before from EMEA that the European Patient Safety Foundation is a member of that organization as well, or have a joint action with many organizations about a patient safety strategy for Europe. And actually it has been a document already prepared for many years, and I was talking to someone within the coffee break and said it must have been hidden in a drawer very long time, but it's needed to really take it up again and make it visible for people to see that all the injuries or the harm that healthcare is costing the society, we can use that money for many better and better purposes, and everything that is preventable in patient safety is worth doing. So we need this strategy for also creating an impact for countries to do their own homework about patient safety.
Thank you very much. Anyone else who would like to share something with us? Yeah?
Sorry, is your micro.
Thanks for the comments, and joint statement on patient safety would be very welcomed, as Eske was saying. I think two things that reflections on one of the workshops we had, and we're like, how do we define patient safety? And I think a clear definition of what we mean with patient safety, it's only adverse events elimination. It's obviously much broader than that, yes? So I think a broader definition of patient safety, so we're very clear on what we're talking, would be useful in that joint statement. The other element, and it was a reflection, and apologies for kind of the naivety, is we're developing sometimes solutions and we say we're bringing patient safety, and we have never really sat down with patients and understood what they needed, yes? Independently, this is in an operating room, so we're saving patients' lives, but have we ever sat down and talked to them about the solution and how the solution is going to save their lives? The answer in our case was not. So in the joint statement, maybe ensuring that patient safety voices are included in any initiative that are going to be implemented in any country or any hospital, I think could also be very important.
Thank you very much.
Hello. I would like to see in this joint statement an area that I think is very important is the education. I would like to see that the area of patient safety is taught in universities, at least, and then in all healthcare professionals. And then something like simulation, training simulation for after you get your degree, because the focus on education and training, I think, is one of the most important things. Thank you.
Thank you very much. Yeah, here. No?
And I will borrow David Borshow's comment in our last panel of the importance of acknowledging the human factors into the implementation process of any technology or any action when we talk about patient safety. And that should also be included somehow.
Thank you. Yes, José? Yeah,
no, I think that I agree with Marta that from today there are at least two main messages for me. The first is because I'm a professor at university, and it's clear that we need to prepare the future generation of professionals considering these disruptive technologies, because they need 6, 7 more years, but in 10 years, really, the technology is completely different than today. And we are preparing the professionals, the future professionals, like some years later. So we never arrive on time. So we need to think about. And the second, for me, message, a very relevant message, is that these disruptive technologies are very useful to overcome one of the most important barriers and challenges, at least from my point of view, in terms of patient safety, that is how to introduce risk management in the service, in the departments, in our institutions. Because safety practices are clear. There is a very good path. But really, if we don't introduce risk management, we are not doing enough. And in this case, this type of technologies are very useful for many things. One is because we expect from the technology a lot of things, and maybe it's open a door to introduce this type in a very simple manner. So these two messages are very important for me from today.
Very good. Thank you.
But I will follow up your question, Mirka, about what will we do when we come home again? Okay? Because it's quite nice to be at a conference, isn't it? Mm. But it's harder actually to create something from what we heard and what we learned into action. But that's really what our aim has been all the time, that we will create something together at this conference to bring home. And if we take action, even though it's the smallest thing, we can do magic. Mm. And you know, soon it's Christmas. We hope for magic. But not only hope will make it. We can do more actions, all of us. And if we also agree for creating some kind of patient safety strategy for Europe and to really set a goal for that, I really do believe that we can do magic in each country, in each unit, for everyone who is both affected by patient safety and work with it in one way or another. So that's my hope for all of us, to go home and think, what can I do? What can I contribute to this topic when I come home?
Well, we are living in a challenging world, and there are a lot of challenges in the healthcare systems at the moment. And we have a huge crisis of the healthcare workers. And using technology can help us override this crisis. I don't mean that technology should substitute the healthcare workers, because, as you said, it's about human and human validity in the whole process. But it can help. If we use it right, we can override the crisis, and we can, I don't know, help nurses, help doctors to survive this shortage.
Yeah, David?
I just wanted to go back to the joint statement, and I think something to the effect of for healthcare to achieve high reliability organisation status requires commitment of both technology, healthcare wellbeing, and government in both policy and funding. And I think that's an important message to emphasise, that we can't do this by ourselves, and that we need to make people aware that implementing these sorts of changes costs money.
Thank you very much. So I will share my personal commitment now that when I will be back home, we will try to write this statement and make sure 160 delegates will be commenting our statement and agreeing on the statement. That's my personal challenge to manage. And
practical one.
Sorry?
A practical one.
Yeah, practical one. I'm often very practical. And I would like to start probably the closing ceremony of our conference. Let's call it ceremony, because we had the opening ceremony with our little hammer. So it's time for the closing ceremony. And I would like to ask Penilla to close our conference.
You know, I rarely use this one because we mostly have virtual meetings with the board. So may I, for this occasion, Mirka, I'm a bit worried about all these glass tables everywhere. But I would start by thanking you all who have been participating, speaking, interacting, networking, and whatever you have been doing. I haven't seen you all, but but not the least, say also a big, huge thank you to our sponsors, our collaborating partners here from Spain. So I am deeply grateful also for our Secretary General, Mirka and Stefan. And I do believe in miracles, you know. But miracles are not only, you know, something that happens from there, just doing this. We can create miracles, all of us. And the biggest miracle from my side would really to achieve a patient safety strategy. But it will happen because of you and with you. Together we can do it. And with that, I urge you also to continue networking outside. Otherwise, Mirka and I will grow at least 5 kilos each. So you need to help us networking and eat. And take the possibility also to continue to create new contacts and experiences together. So with that said, I will officially close this patient safety conference.
Thank you very much, Penilla. And as this conference is now closed, I can already invite you to the new one, which will take place next year in Germany, in Munich, most probably on 24th of October. So already mark your agendas, because we would like to see you again and discuss the new topics that we will be preparing together with our partners from Germany. That will be the German Coalition for Patient Safety, with a representative of Kira, who is, and the organization will be celebrating their 20 years of anniversary. So we will be there to celebrate it with them. And now the second co-organizer will be, I need to read this one, I'm sorry, Klinikum Rechts der Isar, Technical University of Munich, with Angelika Werner, representative here. And we will start as soon as tomorrow during our Council of Affiliates meeting, where we'll be discussing and evaluating today's conference and thinking about the next year's one. So thank you again for coming with us, being with us all day, and we are looking forward to our next edition.